weeks, a healthcare worker commits suicide. Every 3 weeks, a healthcare worker accepts defeat to the inhumane working conditions, the sleepless nights, the appalling pay, and the little appreciation that they receive in return for enduring this.
Every 3 weeks, our government fails these selfless, compassionate individuals who are thoroughly committed to serving us. Change, significant change, is undoubtedly needed.
Christmas time 2022, the country will be experiencing one of the most significant nursing strikes in NHS history, as well as a strike from junior doctors at the beginning of the following year. Both parties are demanding a pay rise and improved working conditions.
In recent years, nurses' wages have been cut by approximately a third, and according to the British Medical Journal, the salaries of junior doctors have been reduced by more than a quarter of their pay in 2008 and 2009. In this video, we will be arguing that the striking of healthcare workers is ethical.
The inhumane working conditions that healthcare workers experience will undeniably affect the quality of healthcare provided. One way in which this will occur is through the deterioration of the psychological states of healthcare workers, which is only worsened by their strenuous work and heavy responsibilities of their job.
This will have detrimental repercussions on the quality of patient care and inevitably lead to higher mortality rates of patients. Strikes will combat the issues presented by the poor working environments and therefore improving the quality of life.
Arguably, there are adverse consequences of healthcare workers striking. A massive concern is appointment cancellations. But these appointments are already of lowered quality due to poor working conditions.
Whilst this strike may be portrayed negatively in the media, a recent poll showed that 75% of the general public would be sympathetic towards nurses striking, and they really aren't asking for much. In fact, nurses are demanding less than what they were paid in 2010, and with some even being forced into using food banks, their small request seems completely reasonable.
Healthcare workers face a moral divide between the responsibility of their role and their rights as workers who are entitled to a fair wage. Despite there being no positive legal right to strike in the UK, the right is fundamental to a functioning democratic society.
In the case of healthcare workers, the NHS Code of Conduct states that all workers have a right to be treated fairly, listened to, and have rewarding and worthwhile jobs. Prohibiting this right would be akin to enslavement.
In underdeveloped countries, however, healthcare worker strikes have shown to have had a more severe impact on the public. This issue, we believe, stems not from the strike itself, but from the lack of resources and investment in the healthcare system of the country.
Striking of key workers is a mild example of utilitarianism. Though there may be some short-term negative repercussions caused by the strikes, they are still considered to be moral due to the greater long-term benefit they will have on society. These morals reflect those of the NHS, advocating for non-maleficence, beneficence, and the provision of the highest quality of patient care possible.
The future of the NHS is already uncertain, with it being severely understaffed, dealing with the ageing population and issues caused by the UK leaving the EU. The latest NHS digital vacancy statistics show 132,139 vacancies across England, with most of those vacancies being nurses.
This number will undoubtedly rise if no changes are made. The healthcare worker strikes will not only improve lives for those working in the healthcare system by improving the quality of care, but encourage others to join the workforce, combating the issues caused by a shortage of staff.
The presence of the NHS is one of the most crucial aspects of the UK that sets our country apart, allowing our population to receive free healthcare. It is imperative that we preserve the NHS and the workers within the system by supporting their calls for improved wages and working conditions.